Hello, my name is Christina Fuller. I am a dental assistant here at Litchfield Hills Family Dental Laser Implant and Sleep Center. Welcome to our patient education meeting on sleep, breathing, and wellness. I will also introduce you to Brittany, an oral myofunctional therapist. She will be showing us the relationship between myofunctional therapy and Vivos oral appliance therapy. We will be muting you throughout the presentation. As I said before, if you could please put your name in the chat box so that we may know who's attending. You can also use the chat box for any questions you may have. The doctors will be online to answer questions for approximately 10 minutes at the end of the presentation. If we don't get to your question and you're interested in getting started, we can schedule you with a consult with Dr. Bolamuni. The phones will be on for approximately 5 to 10 minutes after the presentation. Each of you may be here for a different reason. You may have been told that you have sleep apnea and want to know alternatives to CPAP. You may have a child with ADHD or who struggles with bedwetting. You may be here because your spouse snores so loudly that you sleep in different rooms. By the end of the presentation, our goal is for you to understand that all these things that seem very different may have a common root cause. As we go through this presentation, we start with a focus on children. If you are here as an adult with sleep apnea, at first it may seem odd that we are talking about children. What we have learned is that adults with sleep apnea very often had signs and symptoms as children. There's a good chance we may describe things that you struggled with as a child. So let's get started. There is a silent crisis in America. The column on the left are symptoms that children might be experiencing: ADD, ADHD, bedwetting, mouth breathing, snoring, delayed growth, nightmares, crowded, crooked teeth, dark circles under their eyes, and daytime drowsiness. The column on the right are things that adults may be experiencing: depression, hypertension, bruxism, cardiovascular disease, diabetes, and dementia. Research has shown that 9 out of 10 in America suffer from one or more of these conditions. I am going to show you pictures of 6 children. As we go through the slides, ask yourself, do these children look healthy? In the past, I would have thought they looked healthy too. But now, here is what I see. This first little boy has a double chin and looks like he is overweight. This next little girl has dark circles under her eyes, dry lips, a dimpled chin, and she lacks symmetry in her face. And this third little boy has a double chin, a dimpled chin, dry lips, and dark circles under his eyes. This next little girl has dark circles under her eyes, looks very tired, has a narrow, small chin, and chapped lips. And this next little girl has dark circles under her eyes. She can't even close her lips over her teeth. She has a very tiny chin. She lacks symmetry in her face, looks tired and sad. And this next little girl has dark circles under her eyes, red, blotchy skin. She lacks symmetry in her face. She looks tired and sad, and she has very red, chapped lips. This is what a lot of our children look like these days. In fact, this has almost become what normal looks like. Why are we seeing so many children who look like this? Could it be that there is a common cause behind health concerns that we are seeing? What if these symptoms, ADD, ADHD, restless sleep, sleep issues, swollen tonsils, defiance, aggression, bedwetting, crowded crooked teeth, nightmares, swollen adenoids, daytime drowsiness, dark circles under the eyes, mouth breathing, snoring, difficulty in school, chronic allergies are all linked to a compromised airway. What is the cause of a compromised airway? Possible root causes are narrow dental arches, underdeveloped upper and lower jaws, soft diet, weak tongue, processed foods, weak oral facial muscles, low tongue posture, tongue thrust, and limited or no breastfeeding. On this slide, notice the difference between ages 2 to 17. This shows that growth happens in the lower 2/3 of the skull. At 2 years old, we are about 55% developed. At 4 years old, we are about 75% developed. And at 12 years old, we are about 92% developed. Normal craniofacial growth is wider, forward, and downward. To get answers to these questions, we are going to look at some anthropology. This is Dr. Robert Corruccini. Dr. Corruccini has done a lot of research on the development of the human skull. Today, we are going to look at his fossil studies and his population studies. When Dr. Corruccini looked at the human skulls from 400 years ago, he found that those skulls had bigger upper and lower jaws and that there was plenty of room for all 32 teeth. There was very little incidence of crowded or crooked teeth, and there was no orthodontist back then to achieve this. In present time, very few people have their wisdom teeth, and we don't even have enough room for our 28 teeth without them being crowded or crooked. Dr. Corruccini also studied isolated rural populations, groups of people who were not exposed to things like processed foods and formula. What he found was that these populations breastfed their children for more than 2 or 3 years, and they ate a diet that consisted of hard, tough foods, dried meat, and hard root vegetables. In these populations, they had very little incidence of crowded or crooked teeth, and they had perfectly formed upper and lower jaws. Western cultural influence shows we no longer breastfeed our babies for 2 to 3 years, and we no longer eat a hard diet. Instead, we nurse our babies for 6 weeks or 6 months if possible, and then we give them bottles and soft food like baby food, macaroni and cheese, and chicken nuggets. This is what we should be giving our children: carrot sticks and other firmer foods like broccoli stalks. So we know that having a strong, well-developed tongue is important in making sure that our arches develop correctly. When your tongue is not strong and fully functioning, you will end up with a V-shaped Gothic arch and crowded, crooked teeth. When your tongue is strong and functions correctly, you will have a beautiful U-shaped arch that has plenty of room for all of your teeth without being crowded or crooked. This image shows us that the upper and lower jaws are a major part of our airway development. You can see that if the upper jaw is not fully developed, it will affect the nasal airway. In addition, an undeveloped upper jaw keeps the lower jaw from fully developing because the upper jaw and teeth trap the lower teeth, and the jaw cannot expand forward to the correct position of forward, wider, and downward. When the lower jaw does not fully develop, it impacts the lower airway. Dr. Harvold did research on young adolescent monkeys. He blocked their noses and did airway studies to see the impact of mouth breathing. He found that nasal obstruction leads to mouth breathing and low tongue posture, which leads to malocclusion. The picture on the left shows proper nasal breathing, and this next picture shows mouth breathing and poor tongue posture. Here is what we know. When you have a compromised nasal airway and you breathe through your mouth, it leads to low tongue posture. It also causes tonsils and adenoids to swell. We want to promote proper nasal breathing, so it is really important that we get people breathing through their noses. So how does this all connect to ADD and ADHD? When you have a child who is mouth breathing and has a small airway, it impacts how the child is able to sleep, and they may experience restless sleep and nighttime arousals. When a child does not get a good night's sleep, it impacts their life. This is Dr. Ben Morelia, and he is going to share how airway and sleep may be linked to ADD and ADHD.
Now take a child, alter their quality of breathing and sleeping. And the real big issue now is how will they be during the day? So now you take a child who's 5, 6, 7, 8, it doesn't matter. Their issue has begun years ago. So it's not like you had 1 or 2 bad nights of sleep. You've had a poor quality of sleeping and breathing for years. And the parents have been struggling with so many different issues, and not the least of which is the ADD, ADHD discussion. Because the child who doesn't get a proper night's sleep with a good quality of breathing throughout the entire night is going to wake up and be unrested. And when you get a child who's had a poor quality night's sleep, poor breathing all night long, and you make that happen for years, you know what you've got? A 6, 7, or 8-year-old that's going to go to school and have trouble learning, have trouble sitting still, have trouble behaving, have trouble cooperating, basically have trouble fitting in to what is supposed to be a quiet and peaceful and learning environment. And it's not long after that where the phone call comes to the parent. And when the phone call comes to the parent from the school, what happens is, we have little Jimmy here and he's a little bit disruptive and we really want you to have him evaluated for ADD and ADHD. They're going to be diagnosed with ADD and ADHD, and our solutions are pharmaceutical. If we are given a pharmaceutical, it's usually in the form of some sort of a stimulant. And what that does to the child is it kind of pushes them over the edge and it brings them back to calm. So you basically take an excited or hyperactive child, you stimulate them more, and you bring them back to so-called calm, but it doesn't make a better learning child. You're not going to have a child who's able to learn as well. So now you might have the child sitting still in class because they might be a little more numb or relaxed or calm, but it doesn't necessarily make them a better learner. If we have the so-called ADD, ADHD diagnosis, we're talking about hyperactivity. We're talking about all of the things about behavior and development that land in this category. And the interesting thing about research is, and there is current, ongoing, and past research that shows, children who are sleep deprived produce the same exact symptoms as kids who are diagnosed with ADD and ADHD. In fact, there's a nice study that showed children who were diagnosed with ADD and ADHD were mixed with children who were sleep deprived. And in that group of kids, when they tried to analyze them and look at their symptoms and diagnose them, they couldn't tell them apart. And if you have a group of kids and you can't tell apart who's an ADD child and who's a sleep deprived child, it's no surprise that maybe the ADD and ADHD has a cause. And maybe that cause has to do with the quality of the breathing and the sleeping overnight. And there's a lot of research out there. And one of the pioneers here is Dr. Stephen Sheldon out of Lurie Children's Hospital in Chicago. And he does a wonderful job of researching, and over the decades, he's come to a conclusion, and I've seen him speak, and it's not soon after he jumps on stage and he makes a statement that ADHD and ADD do not exist. They are an outcome of a sleep disorder breathing. They're an outcome of a poor quality of sleep. It's all about the quality of sleep. Another researcher who's produced beautiful research on the same topic is Dr. Karen Bonnick out of Einstein at Yeshiva University. Dr. Karen Bonnick has the largest study to date. 11,000 children were watched over 7 years. And they were divided into 2 groups, sleep disorder breathing children and children who do not have sleep disorder breathing issues. The children in the sleep disorder breathing group, over their 7 years, her study showed that they were 50% more likely to be diagnosed with an ADD or ADHD diagnosis and treated with medication. 50% is a coin toss for our child to be diagnosed and treated with a medication. Also in her group, they were doing testing. They were doing IQ or intelligence testing along those 7 years. And the children with the sleep disorder breathing, their intelligence testing, their IQ scores were dropping over those 7 years. And that's really not the way it works when you're growing and forming. The formative growing years for a child, when they're sleeping and breathing well, your IQ raises to a certain point and then you kind of plateau. We don't see IQs diminishing amongst children.
So now you may be asking, how is this all connected to bedwetting? Dr. Moralia is going to explain the connection between bedwetting, airway, and sleep.
Another thing that might happen is bedwetting. Bedwetting, it's a little more common than people are aware because it's also a best kept secret. Not many people are running around and advertising that their child is bedwetting at the age of 5, 6, 7, 10, 14 years old. But bedwetting does have a relationship to how we're breathing and our quality of sleep. And some of the causes for bedwetting relate to the way oxygen is exchanged in our body. And the way I'll describe it is this. If we're breathing through our mouth, that air coming into the lung isn't really filtered, warmed, or humidified appropriately, and the body can't exchange it appropriately. So a little less oxygen goes to the brain. Now, the brain is a very sensitive organ. When the brain recognizes little changes in oxygen, it goes to work immediately. Because once the brain starts to recognize a little less oxygen, it doesn't know if we're being choked to death, a very serious condition, or if there's an imbalance in how we're breathing at night, but it does start to trigger a little bit of the fight or flight response. And a little bit of the fight or flight response means the brain's going to look at the body and say, all right, if we've got a little bit of an oxygen issue going on, I'm going to pull oxygen from something that it picks to be unnecessary right now and maybe deliver it somewhere that might be more important, planning on a rare occurrence as if the oxygen was going to stop. So if the brain's recognizing a little less oxygen, all of a sudden it's pulled from the urinary tract. If the body pulls a little oxygenation from the urinary tract, it might void. So we might wet the bed.
What can we possibly do? It may not be what you think. This is Hunter. Hunter struggled with bedwetting. When you look at his teeth, you'll see that he has a deep bite and no room for his permanent teeth to come in. Now we know that this is a sign of underdeveloped upper and lower jaws. This is what he looked like just after 10 months of treatment. And he stopped bedwetting in just 1 week. Why? Because he was able to breathe better and sleep better. This is his sister, Paige. Paige also had a deep bite and a lot of crowding. This is what Paige looked like just after 10 months of treatment. Look at the beautiful development of her upper and lower jaw. Remember Michael? This is Michael at age 9, and then again after treatment at age 14. Look at Michael's before and after profile pictures. And now let's take a look at his teeth and see what the difference is before and after treatment. Before treatment, you can see that he had very crowded teeth and he didn't have a very good development in his upper and lower jaws. And after treatment, look at this beautiful smile and teeth alignment. Better than that, let's look at the changes in Michael's airway. With the picture on the left, you can see his airway is narrow. And on the picture on the right, you can see that his airway has nearly doubled in size. If only we had known. What about my child? What about my spouse? What about me? This is Dr. Tiara Griffin. She is going to share her Vivos journey with us. She says, I transformed my life and then my practice.
I'm Dr. Tara Griffin. We are here today in my clinic in Panama City Beach. I've been practicing dentistry for over 11 years. Before I discovered the Vivos Appliance, I was suffering every day with chronic head and neck pain, TMJ pain. I was practicing dentistry and been practicing for 5 years, but I was already looking for an out. I knew that with this much pain, I could not continue to practice dentistry. I had chronic sinus and allergy problems, bronchitis. I was not sleeping throughout the night very well. I was waking up during the night. I had severe daytime fatigue where I would need to go home and actually take a nap in the afternoon, just at lunch, you know? And so I was looking for a solution to the problem, but I didn't know what the root cause was until I learned about the Vivos Appliance. As soon as I started treatment with the Vivos Appliance, within the first 2 nights, I was sleeping soundly throughout the night. My energy was better during the day. The pain that I was undergoing took a bit longer to get resolved, but within the first 3 to 4 weeks, my pain level was reduced by 2/3 or more. Within a month's period of time, I was breathing through my nose better. I wasn't having the same sinus symptoms that I was having before. And within 3 months of treatment, my asthma had improved so much, I had no more problems with the inhalers and the frequency I was having to use with all of my asthma inhalers. My overall health started to improve very quickly. I was my own first patient. However, as I continued to treat the next patient and the next patient going forward, I was curious to see if they were going to have the same outcome that I had, and they did. 9 out of 10 had the very similar outcome that I had. So they were sleeping better in just a few nights, actually getting their energy back. They were less irritable. The pain that they had was going away very quickly. The teeth were beginning to straighten and align over time. So even though with this type of problem, it can take some time to get the long-term results, the immediate symptoms start to improve very quickly. Comparing my before and after picture with the Vivos Appliance, my smile was not symmetrical. My teeth were crowded. The gumminess of my smile was a major problem that I didn't like. I had unevenness in my eyes, also in my nose. My face was more round and less balanced, and that all helped to correct itself as well as I went through the treatment. When the Vivos Appliance is worn in the early evening and while you sleep at night, it allows the jaw to relax. It allows the airway to open up. It allows you to breathe through your nose and to get the oxygen that you need to the rest of your body for your body to begin to heal. By breathing through our nose, we are actually getting much more oxygen to our brain as well as our lungs. And we're producing nitric oxide, which is a vasodilator to allow the blood flow and everything to circulate better. And so a big component with this is it forces you to actually breathe through your nose to get the oxygen where it needs to go into the body. So that's a very important part of this. If you're interested in learning more about the Vivos Appliance, if this would be good for you, then I recommend you coming into a Vivos Center to be evaluated to determine if this is something that could help you.
Here are the changes to Dr. Griffin's airway. You can see on the picture on the left in the red and green, she had a very narrow airway. And then the picture on the right, her airway has nearly tripled in size after appliance therapy. Airway therapy in adults. On the picture on the left, you'll notice her eyes are small. She has a narrow jaw and asymmetrical features. As she goes through treatment, you'll notice her eyes begin to open. Her midface begins to grow wider and begins to grow wider after 5 months. After treatment, you can see the symmetry of her facial features and she can completely breathe through her nose. She looks as though she had plastic surgery. Look how great she looks. Pretty amazing. This patient's chief complaint was her gummy smile. You notice her eyes are asymmetrical. She has a pointy chin and mid-face deficiency. After oral appliance therapy, you can see growth in the mid-face and her symmetrical features. In this next picture, with these two blue plumb lines, you will see that before treatment, her jaw was behind the blue line. And after treatment, you will see that her face has become more symmetrical and that her chin is starting to become in front of the blue line. The patient says, when smiling, I notice that I am now physically unable to smile as big as I used to. My gums are now barely showing. My face feels different when I smile now. I don't know how to explain it, but it's just a great thing. When I speak and eat, my jaw no longer pops. I can speak more clearly and feel a noticeable difference in the amount of room my tongue has. I can breathe very well through my nose now. I am very happy with the results. This patient's chief complaint is waking headaches. But you can see she has a narrow upper and lower jaw and is protruding, giving her a double chin and the appearance of being overweight with crowded and crooked teeth. After appliance therapy, you'll notice that her upper jaw has grown, bringing her lower jaw forward, giving her a more symmetrical appearance, straightening her teeth and symmetry in her eyes and face. In this first picture, the before appliance therapy, you could see that she had a very narrow, elongated face. And after appliance therapy, you can see that her midface has grown and she has become more symmetrical. The goal of treatment is to expand the dental arches, to be able to promote healthy nasal breathing. We need to discourage, eliminate mouth breathing. We need to train the tongue, to strengthen and condition it, reposition the tongue up and forward, and to promote proper swallowing and speech. We really need to eliminate the bad habits of thumb sucking, tongue thrust, and reverse swallow. Vivos is a treatment system made up of screaming, medical imaging, and diagnostics. Here's an example of what the appliances look like. The ones on the left and in the center are typical for adults, and the appliances on the right are what the children's appliances look like. I'm now going to introduce you to Brittany, an RDH and a certified myofunctional therapist, who is going to talk to you about what myofunctional therapy is and the importance of doing therapy for successful oral appliance therapy and growing the upper and lower jaws.
My name is Brittany Sierra, and I'm very, very excited to be working with Dr. Bola and Dr. Brian Mooney to bring whole body wellness to you and your families. So a little bit about myself before we get started. I'm a registered dental hygienist. I graduated from the Forsyth School of Dental Hygiene. I'm a certified oral facial myologist and a qualified oral facial myologist. I have a podcast called I Spy with My MyOI. It's available on all major platforms. The idea behind that podcast was to bring general awareness to everybody, to healthcare professionals, to families, to parents, to adults seeking more information about their overall health, and really with airway being the target of it all, right? Because that's what we're talking about today. I'm also an airway advocate for the Foundation for Airway Health. I'm a member of the American Academy of Physiological Medicine and Dentistry and the International Association of Oral-Facial Myology. I'm a Buteco breathing coach. My private practice is called CT Oral-Facial Myology. We work collaboratively with dental and medical professionals in the United States and around the world. We offer in-office visits and teletherapy as well. So what is oral facial myofunctional therapy? Myofunctional therapy is the neuromuscular re-education or repatterning of the oral and facial muscles. Therapy includes facial and tongue exercises and behavior modification techniques to promote optimal tongue positioning, improved breathing, chewing, and swallowing. What are the goals of a myofunctional therapy program? We want to establish dominant nasal breathing all day and all night. We want to establish a competent lip seal all day and all night. That means lips closed unless you're speaking or eating. We want to establish proper tongue rest position. That's the tip, middle, and back of the tongue resting up at the spot. If I ask you all to say the letter N for me right now, where the tip of your tongue hits is where the tip belongs, and the rest of the tongue should follow suit up there, lightly suctioned. We also want to develop correct swallowing patterns all day and all night. And that is with the tip of the tongue pressing hard up at that end spot that we just discussed. So in short, we correct excessive dysfunctional habits. And our goal is to develop a coordinated and harmonious facial muscle pattern. If these goals are accomplished, that's how proper dental and craniofacial development will take place in a growing child. So what's considered to be dysfunctional? Mouth breathing. Low tongue rest posture, whether it's in the floor of your mouth, middle of your mouth, or maybe even a little bit forward against your teeth. Lips apart at rest. This is not our healthy natural state, and it will lead to problems down the road from childhood into adulthood. You just listened to some videos from Dr. Ben Moralia, and when I listen to him speak, he always states how an unhealthy child turns into an unhealthy adult. So that's why you're here right now. And some of you, it may be the first time that you're hearing about it, but thanks to Dr. Bola and Dr. Brian Mooney, they have brought to your attention that your airway matters. It trumps everything. We can live 3 weeks without food, 3 days without water, and only 3 minutes without air. The dysfunctions that we discussed above must be corrected for your Vivos treatment to be effective and for long-term success. So some of the things that we noted, our mouth posture and our lip seal. Now, some of you may not be sitting there with your mouth gaping open, but even a tiny, tiny bit with those lips spread apart, anywhere, even say 3 millimeters, is still considered an incompetent lip seal. We need those lips together. Look at this tongue rest posture resting here. You see the dry, cracked lips. You can see the asymmetry in these lips. So I have a challenge for you guys. I want you to suction your tongue to the roof of your mouth, and I want you to try to mouth breathe. Are you able to? No. So it's when our tongue posture drops that we begin to mouth breathe. So where your tongue rest matters, where your lips rest matter. It affects our overall posture, our tongue posture, our lip posture, and then our body posture. If we have our tongue where we want it to be, and we have our lips closed, and we are breathing through our nose like we're intended, we are obligate nasal breathers, we will see postural changes as well. So this is a picture of one of my patients. She was a 13-year-old female, and you can see the before, see this forward head posture, the rolled shoulders. And then in here, you can see how her ears are more in line with her shoulders. She's holding my little dog right now because she wouldn't take the picture for me unless she was able to hold the dog. So what happens if we have a restricted tongue or a restricted lip and we can't really even move it? So how are we supposed to obtain that proper tongue rest posture, that proper lip seal? Well, we're going to be screening for tethered oral tissues today. Tethered, thinking of, something being restricted. That's something that we need to screen for and might possibly have to take care of. And Dr. Bola and Brian Mooney would do that for you, and I would prep you for it with myofunctional therapy. You have the same muscle attachment underneath your tongue and underneath your lip. So patients with tongue tie, they often develop a tongue thrust swallowing pattern where the tongue pushes against the teeth. And this is what we call a reverse swallow pattern. So tongue tie evaluation, that restriction will really prevent the tongue from reaching the palate easily and comfortably. One of the things that I'll ask you to do is to open widely and try to bring the tip of your tongue up to your palate. How much does your jaw have to close for you to really get the tip of that tongue to contact that palate? Often we see compensatory muscle patterns associated with tongue tie. We'll see that forward head posture, those shoulders rolling, a lot of neck tension, shoulder tension, clenching and grinding in the teeth, chronic headaches, chronic shoulder problems. It's a lot of tight fascia that runs from literally from our head all the way down to our toes. So now that you understand myofunctional therapy is needed, it's completely necessary in conjunction with your Vivos treatment, your next question for me is going to be, well, how many sessions am I going to need? You will be enrolled in a 14-session program. Think of it like physical therapy for your mouth. Our first appointment will be a comprehensive evaluation where we will be able to develop a comprehensive treatment plan individualized to you and your needs. So which do you think you need help with? Nasal breathing, lip seal, correct tongue posture, or correct swallowing pattern? I look forward to meeting each and every one of you, and I'm going to give it back to Dr. Brian Mbola-Mooney. Thank you, everybody, for listening.
Patients always have questions at the end of these presentations. The top 3 questions are, does this hurt? That's a great question. This is a non-invasive, non-inflammatory, non-surgical treatment option, and it doesn't hurt. The appliances are usually worn in the evening and throughout the night. The number 2 question, how long does treatment typically take? This varies depending on the patient and treatment. However, usually 18 to 24 months for adults, and with the kids, it depends on the age, the growth, and how fast they lose their teeth. Number 3, does this relapse? No. When we grow the jaw, the teeth will follow. If you haven't already, if you could please put your name in the chat box below so that we may invite you to come in our office and do a complimentary CBCT scan valued at $1,000 so that we may take a look at your airway for you. I'll be following up with you tomorrow to help you get this scheduled. I'm going to now open it up for any questions that you may have. The doctors are online to answer, and you can also use the chat box below to type in any questions that you may have. Thank you for joining us this evening.
Thank you, Christina. Good job. Does anyone have any questions? Hi, Camilla.
Please feel free to unmute yourselves if you have any questions.
No questions? Yes, I'm sure somebody must have a question.
Come on, guys, don't be shy. That's what we're here for.
So who's thinking of getting something done? So we can talk about what the protocol is when you come in and we look at your airway when we get the CBCT, and then if we decide, we can also get you a sleep study, which would give us a lot of information also besides the CBCT. The sleep study, which is a take-home sleep study, and you download the app on your phone, and we upload it, and we get it read by a sleep physician. We don't do the reading, but we can interpret it. I can tell you what it looks like, what's happening, and the sleep study basically shows us if you have mild to moderate or severe obstructive sleep apnea or any other kind of sleep disorder breathing, any other sleep breathing disorder. So that also tells us like how many times you stop breathing at nighttime for 10 seconds, what kind of your sleep fragmentation, how many times your oxygen level dips below 90 while you're sleeping, and if you are going through any kind of bradycardia, I mean your heart rate is going really, really fast, or you're like running a marathon during your sleep. There's a question that says, what if someone has sleep apnea from being overweight but was breathing normal before? Should they consider this, or do they just have to lose weight? if they have sleep apnea, it's not going to go away. So it has to be treated. But the weight is also a component. We do have to nutrition, weight, that also helps in lowering your obstructive sleep your AHI number. So you do need to lose some weight also. If you're obese, if the person is obese, or even if you only have to lose a few pounds, it only always helps. But the sleep apnea doesn't go away though.
Does that pick up in the airway analysis or when you're looking at their BMI?
Yeah,
that's evaluating the patient as a whole.
When we do the evaluation for the patient, we also we take the weight into consideration. We do the BMI, so that all goes in part of your treatment plan for you, which includes nutrition, sleep, the appliance. So yeah, weight does play a factor. Somebody said, my husband snores with his mouth closed through his nose.
Yeah. So no one patties before. And then between that space of air coming through his nose and vibrating from his soft palate onto the posterior aspect of his tongue. So you could just start on that.
Yeah, so the soft palates, which is another thing that we do with the treatment also, is what we call night laser with our laser, because when the soft palate the tissue is floppy in the back, and so we tighten the muscles, the soft palate tissue to strengthen the collagen, regenerate collagen up there so that I'm sorry, what?
You started reading another question.
Yeah.
But the treating the soft palate, I have my Vivos in right now.
So it doesn't sound right.
But breathing through your nose, that vibration, that air turbulence going through your nose and that soft tissue in the back of your throat vibrating up against your the back of your tongue. So what Dr. Ray was saying, that part would be treated with the night laser, the laser treating the back of your the soft palate to tighten the collagen to get that soft tissue off the back of your tongue, and that in turn will open up your airway as well.
Yeah, but you still need to do the sleep study for us to know, because snoring, any kind of snoring, and at some point he's definitely not breathing through his nose. So that's all part of it. So we do need to get him breathing through his nose, and we need to do the sleep study.
Yeah, there is an obstruction back there.
Yeah, so there's definitely an obstruction, and also the CBCT also. You would have to wear it's an appliance. You would wear it early evening, about 14 to 16 hours a day. So you can get your 14 to 16 hours early evening, also the night, because you have to wear it overnight. And then you can wear it 2 hours in the day, in the morning. You can get your remaining hours like during the day. You don't have to be consecutively wearing it for the whole 16 hours, except for overnight, though. You do have to wear it overnight, because that's when your body is repairing itself and oxygen is going all over the body to heal the body. And there's the growth hormones are very active while you're sleeping.
Yeah, even for the patients with the TMJ, they're decompressing the joint, you're remodeling the joint. Because a lot of the patients present with the severe TMJ issues.
They do. So basically he was saying that because he's got his appliance in, and he'll take it out and show everybody. So because he is wearing
Hey, Paul.
an mRNA, which is cleared for mild to moderate sleep apnea.
Yeah, I didn't know I had sleep apnea until I did the sleep study. I was like, geez, right? How many times?
Yeah, you were like in the moderate side.
Yeah, but how many times
So
did I stop breathing for 10 seconds or longer?
It was like between 15 and 30.
30 times.
And during the hour for 10 seconds, he was
longer.
He stopped breathing for 10 seconds, and we wouldn't have known that. We knew he snored, but we wouldn't have known that if we didn't do the sleep study and do the CBCT to see what his airway looked like.
Yeah, that's mandatory. You have to do the sleep study.
Yeah, we must do sleep study before anything.
Yeah.
Now the appliance there's no pain. That's part of the whole thing. There's no inflammation. It's just stimulation. So if anything hurts, we have to adjust it. There's no
Something should be hurting.
Nothing should be hurting. You know, sometimes your jaw from remodeling, you know, you may have some discomfort, then we have to adjust the occlusal surfaces of it. Other than that, no, it's just stimulation. The proprietary springs in the front of the appliance, you know, is what stimulates the stem cells, and to stimulate osteoblasts to grow bone and to develop the maxilla.
So can you go through what a typical treatment length would be, and also how many visits, how many, you know, I would assume that those appliances would have to change over time in size or what have you. For me, as Dr. B knows, you know, I suffer from overcrowding of my teeth and also tinnitus in my ears, which we talked about in my last visit. So yeah, just if you can go through typically what a treatment would entail and how long and that kind of stuff.
Okay, so you start, if you come in, you decide you want to do it, we'll do a consultation where we take all sorts of photos. We do intraoral scan, we take a bite, and then we do the CBCT, we give you a sleep study, the take-home sleep test, and that comes back, we look at it, and it tells us, you know, whether if you have obstructive sleep apnea, it's been read by a sleep physician, and then we put all these, all the information, you put all this information into what is called an airway intelligence report is created. So basically they do an analysis, they do all kinds of drawings, like, you know, where the angles are, your eyes, your nose, your jaw, and we see all the slices of what your jaw looks like, why you're getting ringing in the ears, what your joint looks like. So having all that information, we then develop an appliance that's going to work for you.
Okay.
And then at that time, we will know how many appliances you may need. You may need, some people may, depending on how much growth they need, they may need up to 2 appliances on the top, you know, 2 DNA appliances. And if you have obstructive sleep apnea, you're going to wear like the ones he's wearing, which is an mRNA. So it's a double one. It's a bit bulky, but he still manages to speak with it. So I guess, you know, you can speak with it. I think he's the only one who does, though. And then, you know, so depending on how committed you are, it's hard to say. Some people are done in 12 months, 18 months, and some people, you know, longer. If you don't wear it, nothing happens. And then after you wear it, your first visit, you come after a week, so we know that you know how to turn the screw, because you have to keep turning the screw on the appliance. And then after that, we see you every 5 to 6 weeks. And then halfway, like say in 6 months, we do another sleep study to see where you are, make sure that everything's working nicely. And then at 12 months, we do another one and we'll see where you are.
As a halfway, 6 months, like 12 months, are you still taking a CBCT scan?
Yes, we are. We're doing a new sleep study. And then depending what you have, if we're seeing like real growth with your appliance, then we'll do another CBCT.
Okay.
Dr. A, are they finding that if they wear the appliance more throughout the day, like if they got in more than 16 hours, does it decrease the amount of time that they would have to wear it overall?
No, it's 14 to 16 hours. It doesn't, I don't think it changes anything. But if you wear less than 14 hours, then definitely nothing is happening.
Yeah, I find like 14 hours, whatever, is no big deal for me. I mean, I get home, have dinner, I'll just say, put the appliance back in, go upstairs, brush my teeth, clean the appliance, go to bed, wake up, same thing, take it out, clean it. I leave it out, come downstairs, have some breakfast, have my tea, come to the office, finish my tea, and then before I get to see the patient, I pop it back in my mouth again. It's like, look, I want this thing done. I've been dealing with this thing for 40 years. I've had it. I want this problem fixed. So, yeah, I mean,
well, just so everybody understands, so he does have, I mean, originally we were trying to develop him because he has a deviated septum, he had 4 rounds of orthodontics,
can't breathe through my nose.
And can't breathe through his nose, and he did have surgery. So with the ENT, so all that was before we did the sleep test, and then we found out that he also has OSA, obstructive sleep apnea also. So we knew that we were dealing with a whole bunch of
Yeah.
other
Now,
things.
You know, with Vivos, I mean, my issue, not being able to breathe through the nose, a high palate, underdeveloped upper and lower jaw, which is why the 4 rounds of braces, everything relapsed and went back.
Yeah.
So it's, yeah, so that was a waste, and then not being able to breathe through my nose. But as you develop that upper jaw, you can develop that nasal aperture by 2 cubic centimeters. Probably we talked about the size of 2 dice. So being able to breathe through my nose, to get my CMJ, the headache, see my bite balance. This is really getting to the root cause of it, actually growing the skull to where it should have been. And then I should have worried about straightening the seat.
Yeah, so there'll be a phase 2, just so you know, depending, phase 2, meaning after we grow and develop, where you end up, you may have some spacing where we have to treat cosmetically, or you may need some like clear aligners to move the teeth to, you know.
Yeah, a little tweaking.
Yeah, to straighten the teeth or just fix the bite a little bit better. And another thing is that we're finding that most of the problems that people are having is from orthodontic relapse. So they do also the teeth relapse move, but then they always end up with some clicking and popping in the joints because they just don't take that into consideration when some do anyway. All the ones that we're seeing that are coming back, especially the young ones, you know, in their 20s, 21, 19, 18, 16, like click and popping, including my 15-year-old too. She finished hers and she had popping and clicking in hers. Then she snores, and then we realized that she also needed to develop her airway because she also has a deviated septum, which we never would have known if we didn't do the CBCT.
Yeah.
Yeah. As an RDH, I'm aware that oxygen deprivation from mouth breathing also contributes to relapse orthodontic treatment, fatigue, and depression. I'm not understanding what the question is.
I think it's more of a statement, Dr. A.
Okay. But it's, I mean, not breathing through your nose, airway, like we say, trumps everything. It's obstructive sleep apnea. It leads to yes, stroke, diabetes, high blood pressure, you name it, depression, fatigue, and then not breathing through your nose also, yes, that's all part of symptoms of not getting a good night's sleep, not enough rest, headaches, neck pain, joint pain, back pain. It's all connected, one big fascia all the way down.
Yeah, they start compensating for all your joint pain.
Yeah.
And then as you're posturing, moving your head forward, then you got neck pain, that travels down your spine, then you got lower back pain.
And then that's all like is seen in that sleep study, the sleep study that we had, the sleep image sleep study. It gives a lot of information as to, you know, all the things that are happening while you're sleeping. This is why people are waking up with all kinds of pain everywhere because of the type of sleep that they're having, the fragmented sleep and the quality of their sleep.
Hey, Paul, that's a nice picture of you up there.
It sounds like the thunder and lightning has stopped over here.
Yeah.
Does anybody
I
have
still hear it a little bit.
Oh.
They get drenched.
Does anybody
don't tell your daughter that's from San Francisco.
Oh.
What's that?
The weather is from San Francisco.
Oh, yeah.
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 Okay. Does anybody else have any more questions? This is definitely, you know, we are trying to save one life at a time. It is, you know, that's what we say, because at the end of the day, this is something that's been going on for, it's becoming more in the forefront. They've had 10 years of research, like everything is always evolving, new stuff come out, and then we're just on top of technology. And, you know, we see the value in this, why all dental work is, you know, gets, all your crowns get broken, teeth are broken, you get recession, grinding, clenching, mouth breathing, you know, caries, dry mouth, but the list goes on. People with all kinds of meds, little 9-year-olds on Prozac, Zoloft, everything, you know, everybody medicine. So if we can just treat underlying causes and like I said, one life at a time is just what we're trying to do here. And And that's all we can do. And we just want to educate. And once you see people, you can't unsee what you've seen today because everybody has something, but and nobody knows, and these don't get treated. And people do die from sleep apnea every year, lots of people, because it's undiagnosed.
Yeah, facts.
I want to thank everyone for joining us this evening. Thank you for giving us part of your time on this Memorial Day almost weekend. I hope everyone has a great weekend, remains safe, and doesn't pay too much in gas prices, because I heard they're going to be ridiculous this weekend. If anyone has any further questions or any other concerns, or they would just like to ask some questions privately and not through this forum, please do not hesitate to give us a call. We will be here at your disposal. I will be following up with those of you that joined us this evening to help you set up your free CBCT x-ray so that we can take a look at your airway and have a discussion with you. Thank you and have a fantastic rest
Thank
of
you,
your
everybody. Have a good evening. Thank you, Christina.
Thank you.
I see
Thank
you,
you.
Paul.
evening.
Bye.
Bye, everyone.
Bye. Bye, Diana.
Sure.